Hepatitis B, or Hep B, is a virus that causes infection and inflammation of the liver. The Hep B virus can be found in bodily fluids such as blood, semen, vaginal fluids, and even amniotic fluid. But how do people get infected in the first place? Well, common ways people get exposed to the virus include needle or syringe exposure, where a needle or syringe used by someone with hepatitis B is then used by someone who doesn't have the virus. There's also mother-to-child transmission, where a mother infected with hepatitis B passes the virus to the child during birth. You may also get it by having unprotected sex with someone who's infected. Basically, if you come in contact with infected blood or bodily fluids, there's a risk of contracting hepatitis B. Okay, so what happens if you do get infected with Hep B? Once a person is infected, symptoms may not appear until 1 to 4 months later, and some people may never develop any symptoms at all. When symptoms do appear, they can include abdominal cramps, fever, vomiting, and extreme tiredness. Now, hepatitis B can cause two types of infection, acute and chronic. Acute Hep B is a short-term infection, meaning your body is able to clear the virus on its own within 6 months. Other type of infection is a chronic infection, where the body is unable to get rid of the Hep B virus at all. Individuals with chronic hepatitis B are at increased risk of developing liver failure, liver cancer, and cirrhosis, which is a severe scarring of the liver. So what can you do to prevent yourself and others from getting the virus? The most effective way to prevent hepatitis B is through vaccination. Getting the hepatitis B vaccine will provide 90% of protection. Avoid sharing needles and personal items like razor blades and toothbrushes, as a small microscopic amount of blood is enough to cause an infection. Wear PPE such as gloves if you need to clean up bodily fluids,